Marigold Health has a mission to give people more agency in their recovery from really anything, but in particular mental health and substance use conditions. And what we are is a combination of, essentially a souped up coaching program where we train people who are in recovery themselves to support patients today. But what makes us really special is that that support is built on top of an anonymous recovery social network.
Marigold Health provides 24/7 anonymous group chat support to people who have behavioral health conditions who are interested in recovery. And the peers at Marigold are providing one-to-one support as well as app-based chat support to those folks who are interested in recovery.
At the front of it, peer support is living proof that recovery is possible. Peers who have shared lived experiences are certainly living proof that you can live well with a number of chronic illnesses or chronic diagnoses, but they are very much focused on activating that person and helping that person live their full entire life.
As a peer at Marigold, my job is to provide encouragement and empowerment to individuals in their recovery journey. So my biggest thing about recovery that I've learned is that it is a lifelong journey. And being a consumer of services myself, I think has helped me in being a lead peer in Marigold because I understand myself just that journey, and whether that's by way of me sharing my lived experience, providing resources or tools that they may need, and overall inspiring hope.
We hire some top-notch peers. We look for the top 10% of people who are doing this work. And we have a rigorous hiring process that we're screening people and looking for people who do have a solid recovery and have an understanding of recovery principles and meet the national standards for peer support. And they help develop wellness plans with people who are interested in having their own recovery goals to work towards. But much of their work is based in those chat groups in the app, developing groups that are specific to the needs of members who are in the app, but providing basically any support they need. Peer support is such that we've been there, done that, we've been getting services inside the system, so we know the road in a very different way than a clinician may.
And really the goal also is to use this engagement, right, this 24/7 engagement in these groups to also better connect that peer support to clinical care. So we have different AI and other technology systems that can pick up different needs as they're expressed in chats and set up follow-ups for other members of the care team.
I've been a physician for over 25 years, and I have largely dedicated my career and my clinical practice to diverse, complex, vulnerable populations. That has occurred in FQHCs, where I was a medical director for a number of them, also in large managed care facilities in terms of Medicaid, Medicare, commercial cross lines of business. I've been involved in creating a lot of innovative programming and supporting the creation of innovative programming to reach those that are hardest to reach. We are looking for ways to better engage and retain, and those who were using the Marigold app became stickier in care. And this is, to me, an extremely powerful piece, and which is why I'm so dedicated to Marigold and so happy to be a part of Marigold.
So one of the reasons I really love to work at Marigold is that there's hope, right? It's very inspiring to think about the work we can do. And the reason that I think everybody here can be more hopeful is recognizing that maybe we don't have enough people who are trained as therapists, but we have millions of people who are in recovery themselves who are able to use their skills to support others. And what Marigold is able to do is give those folks the opportunity to give back, to share their lived experience with others. So ultimately what we're building is something that is about actually filling the massive need that we have. And there's a new workforce of people to do it that have kind of been right under our nose the whole time. So if you're a provider, whether you're practicing on your own or you're practicing in a larger provider, what you should look at Marigold is basically an augment to your care team. We can give you a way to keep people engaged, to keep people retained all across when your office is closed, and to flag needs within your patients right as you actually need to follow up. And Marigold has a way for you as a clinician to integrate that with the care you're rendering today.